So we've actually recently had a girl about 14 or so who had a collapse and had a basilar artery occlusion. So the basilar artery is a large artery at the back of the brain that supplies your brainstem and its critical functions, things like breathing, consciousness, that kind of thing. And that clot had actually come through a hole in the heart and then progressed up there. So we ended up retrieving that clot with an aspiration catheter, and she actually went back to school within a week or so, which is fantastic, because having been left alone, that would have progressed to potentially locked-in syndrome, which is where you really can't move arms or legs and essentially just you've got above about here. Or she might have progressed to death, which is obviously a terrible outcome as well. So if your child develops focal neurology, and by that I mean if there's one side of the body not working, or if they take a strike to the neck with a ball, that kind of thing, and then they've got, decreased conscious level or something like that, I think getting them to hospital early and not just seeing if it gets better by itself is probably important. 9 times out of 10, there'll be nothing there. And even if we do a scan and we find nothing, well, that's fantastic. We don't need to do anything. I think people are obviously worried about wasting time, and I don't think that should be the right way at all. And if you have any concerns, time is critical. Worst case, we scan you and we find nothing. Well, that's fantastic. Less work for me.